Hi everyone, welcome back to the next instalment of the BDI vlog series. Today we're going to talk about clinical governance and audit. Chances are, if you're doing interviews in the UK for the NHS, you're going to get questions about this. It's probably something that you're doing some of in your current role, but we're going to talk about just exactly what it is. We're going to talk about the 7 pillars of clinical governance and ways in which you can kind of prepare for those questions that come up. Okay, so first things first, what is clinical governance and audit? Basically, and again, you're probably doing this in your own hospital, so I hope this isn't telling you to suck eggs. Basically, it's where we look at what we're doing or what you're doing clinically, and then we evaluate the effectiveness of it, and we can decide whether or not we want to raise the standard or just monitor whether or not we're keeping to a specific standard, and then implement new ways in which we can get better. So it's about constantly driving innovation in the NHS and making sure that patients are getting the highest level of care possible. Okay, so the first of the 7 pillars is clinical effectiveness and research. And basically what we want to do is make sure that the procedure that we're doing or the way in which we're treating the patient is up to date with current standards. So we're using research to make sure that we're being as clinically effective as we can be. It's kind of that thing where surgeries, medicine is advancing all the time. Is what we're doing the kind of, as I say, the up-to-date, most best practice. So if you're looking at, for example, a surgery, is the technique that we're using and the tools that we're using, are they the most relevant for that patient? Are they getting the best result possible? So can we be looking at medical research to make sure that there aren't other ways and better ways in which we can be performing, whether that is, as I say, a surgery or a particular medicine that we're prescribing, and making sure that we're keeping up to date with current practice. Okay, so pillar number 2, we're going to talk about audit. Now, that's something that you may already be involved in again in your current practice, but it's a really good one to be able to evidence as part of an interview, especially when it comes to things like CSER. There's a really big part of clinical governance and audit that goes into a CSER completion or portfolio that you would submit as part of your Article 14. That's how you're going to get your specialist registration to be able to work as a consultant independently. Now, basically what you need to do is evidence where you have taken on a task or project within a hospital, identified something that you want to change. So it might be that you want to edit the way that patients are treated, or having an effect on decreasing waiting times, efficiencies in your department, or it could be something more practical to do with the clinical treatment. We're going to gather information about what's happening currently, check whether or not it consists with the guidelines that you have in place within your trust at the moment, and then you're going to decide what's your new standard, or what is the standard that you want to get to. If you can then implement change, you're going to implement a new way of working or a new process or practical clinical technique, and then you're going to gather data about the effectiveness of that, or hopefully it's been effective, and then you can compare and contrast to whether or not it's made a difference to what you were doing before. A lot of the times we hear that that's where the audit cycle finishes, but in the UK it's really, really important that we retest after a period of time to make sure that the changes we've made have had a continuous impact on the practice that we're having. Okay, number 3, risk management is the next pillar we're going to talk about. As it says on the tin, that's basically identifying where there is risk or where there could be risk to either patients or staff members, and then trying to mitigate that to reduce the risk in the future. So it's going to look at both sides, as I say, for the patient and the clinician. So it could be something like, if there's an impact on ambulances backing up, bed blocking, what can we do to combat that? If you're noticing that there are particular outcomes, negative outcomes with a procedure or a process that's happening in the trust, again, identifying what risks are having a negative effect and then making change to make it safer. Okay, next one up is education and training. Obviously a really, really important one. As doctors, you're going to spend your whole life learning. It's going to be a continuous process. It's not like passing your driving test where you pass it, you got your license and that's it. You need to be making sure that you're keeping yourself up to date with practice all the time. And as with most of the pillars, this point is mostly about making sure that patients are safe and that we're constantly getting better. Part of that as doctors is that you're going to have to go through continuous professional development, so CPD, and you'll be building points anyway as part of your revalidation, but it's really important in an interview that you can evidence what kind of things you're doing on a daily basis or weekly or monthly basis to influence your practice. So that can be things like reading journal articles, reflecting on how they are improving your practice, attending conferences, journal clubs, could be poster presentations. But if you are in an interview, it's really good to have a kind of set of examples that you can give for how you are continuing your education constantly. Okay, number 5 is patient and public involvement. Again, I mentioned revalidation, and part of this might be involved in this area of audit and clinical governance, but it's basically about involving the patients and making sure that they're involved in their treatment and the process of maybe the relatives' treatment, and also the wider public. So that will be things like making sure that we are providing feedback forms, that we're engaging with families or patients to make sure that when you are delivering a particular treatment plan, that it takes into account their perspective, because there may be personal circumstances that will edit or change the way that we approach a situation. In terms of the kind of public forum, it might be that you have an opportunity for anyone who visits your hospital department to give critical feedback, you know, good or bad, about what it is that they're there for, whether or not they're happy with the care they're receiving. And I know that in some NHS organisations, they also have kind of public opportunities or forums where people can turn up and have input into the care that's being delivered to their community. So again, another really important one, but if you're in an interview, it's probably something you could evidence as part of your CPD. Alright, so the penultimate pillar is information and IT, and that's going to be focusing on how we use information, how we store it, and how we process it. So I'm talking about patient records really, or information that pertain to particular patients you're seeing. Again, as part of the audit cycle, you'll have to be gathering data and processing it and using it. So it's making sure that you're aware and thinking about things like GDPR, which is the kind of privacy aspect of the way that we process information about other people. So we're going to need to be storing that information somewhere. We're going to need to be doing analysis on it in order to come up with the results for any audit work. So you need to be thinking about and be aware of how you're gathering that. Are you doing it compliantly so that it's safe and it's confidential? And then what IT systems are you using? So whether you're using Excel, for example, to compile information, or SPSS to do data analysis, all the different IT aspects to safe storage and processing of information. Okay, we come to the last pillar, and that is staff management. So that's going to be making sure that within your department or your area, you've got the right people employed to do the right jobs, and that everybody has the kind of resources and the colleagues around them to make sure that patients are receiving the best care possible. So being aware of who's involved in the team, have you been involved in any sort of leadership or hiring responsibilities, and then as an employer or within your department, a leader, making sure that the environment that you work in is a kind of safe, comfortable and efficient one for everybody that is employed either alongside you or beneath you. So, you know, staff welfare is quite a big thing in the UK. You want to be able to evidence that you can work as part of a structured team really effectively. Okay, so pretty short video today, but thank you very much for watching. I hope that's helpful in kind of explaining the 7 pillars of clinical governance. If you are going for an interview and you're worried about it, or you're kind of considering which of the pillars you want to talk about, maybe you're struggling to come up with examples of your current practice of any of them, get in touch with us. We've got a good library of resources that can help you prepare, and we can give you ideas that you can use in your interviews coming up with the NHS. As always, as I say, thank you very much for watching. If there's anything else that you want us to go through in a video or a blog or in our podcast series, do get in touch. And most importantly, if you're looking for a job in the UK, please don't hesitate to reach out. Thanks very much.